Checklists. Checklists can be really powerful tools in the search for safe or reliable practice. Checklists come in all shapes and sizes and serve several purposes. Great care must be taken in their use. This video relates to the formal, deliberate and orderly process that takes place in 3 specific situations. Situation 1, immediately before a safety or process critical activity. Situation 2, when an abnormality is detected. Situation 3, when an emergency is declared. Each type has its own form and function. 3 conditions require 3 categories of checklists: normal, non-normal and emergency. The normal checklist is typically challenge and response. Its underlying assumption is that you know how to do your job. It is structured to support memory or coordination through a series of prompts. The prompt will normally be a single word and the response to it succinct. The non-normal checklist is ordinarily read and do. This type of checklist is a how-to guide for when things cease to be normal. The goal is to restore normality or to control the trajectory of the abnormality. It supports memory or cognitive capacity for ambiguous or infrequently experienced situations. The emergency checklist is initially completed from memory. An emergency is declared and there is an immediate need for action. The initial activity is completed from memory according to an appropriate algorithm. Users need to be sufficiently disciplined in their execution of all checklists. A healthcare example. The WHO Safe Surgery Checklist is probably the best known checklist in healthcare. It is a normal checklist. Its purpose is to avoid harm arising from the clinical activity, iatrogenic harm, as opposed to harm arising from the patient's underlying disease or condition. The designers identified 10 safety critical items. There are 3 peaks of iatrogenic risk in any surgical procedure, so there are 3 separate checklists, each undertaken immediately prior to each peak. The first peak is when the patient is anaesthetised. The checklist is called the sign-in, and major risks are patient identity confirmed, the need to breathe for a paralysed patient, an escape route if equipment fails, the administration of drugs and allergens. The second peak in risk is when the skin is first broken. This checklist is called the timeout. Major risks are patient identity and selection of the correct surgical site, fluids escaping from and infection entering the wound. The third peak is when the surgery is complete and the anaesthetic process can be reversed. This checklist is called the sign-out. Major risks are items unintentionally left in the wound, samples removed or not treated appropriately. Each of these risks can be tested by diligent and disciplined single-word challenges and single-word responses. Well-designed and properly used checklists can be a really powerful tool in the search for safe and reliable practice.